Good morning, everybody. Welcome to Friday morning. Welcome to our first free webinar of 2024 as PAM Wellness. We'll just give people probably another 30 seconds and then we will just get started. But I'll just run through some quick housekeeping before we introduce your speakers for the day and we get started with today's seminar. You have got yourselves on mute, but obviously if you want to ask any questions during today's call, we will have a Q&A available for you throughout the session and again at the end. We do ask you to just keep yourselves kindly on mute for the duration of the session and it will be recorded for you as well. So we're a couple of minutes now after 9:30, so we'll get ourselves started. So for those of you that have just joined us today, good morning, welcome to Friday morning and welcome to today's free webinar that's delivered to you by PAM Wellness. In today's session, we're going to be exploring cancer awareness, and in particular, this is to support World Cancer Day, which we saw at the start of February on the 4th, by looking at the role of health assessments, cancer screening, and then importantly, psychological support. So my name's Laura Jordan. I'm the commercial director at PAM Wellness, physiologist and charter scientist by trade, and really excited to be joined by Adam Brazendale.
Thank you very much, Laura, and good morning, everybody. Thank you very much for your attendance. As Laura said, my name is Adam Brazendale. I'm the Senior Mental Health Trainer for PAM Wellness. I joined PAM 7 years ago as a counsellor and step care therapist, and my role now involves the development and design and facilitation of a number of training programmes and broadcasts on the many topics of mental health and mental well-being. And I'm absolutely delighted to be invited here to join you all and to present with Laura this free webinar on the role of health assessments, cancer screening and psychological support.
Thanks, Adam. So just before we start today's session, just to remind you or to introduce you, if you haven't joined us before, to our free sessions. These are designed to be free high-level taster sessions that just give you a flavour of the training and workshops that we have to offer at PAM Wellness, but hopefully they'll give you a few hints and tips that you can take away both personally, but also in the workplace as well. Like I mentioned at the start of today's session, if you have got any questions, please use the Q&A feature throughout the webinar and we'll have a look at that at the end and we'll answer those as best we can for you. If you have got any questions or you want to know how we can support you and your workplace, then you'll see the email address on the screens now and we'll share that again at the end. And likewise, if you've got any further questions that you want to ask us, you can get us at businesssupport@pamwellbeing.co.uk. So without further ado, as you can see, we've got a pretty jam-packed agenda this morning. We're going to start by looking at the physiological aspect of cancer and specifically recognising the importance of not only whole body health assessments or health screening, but also the importance of including cancer specific screening. And what I'll do here is I'll talk to you about the different types of screening, or probably the most common and most popular types of cancer screening. And then we'll have a look at the benefits of the workplace. I'll then hand you over to Adam, who will take us through the importance of supporting staff affected by cancer and how best to communicate with those colleagues to look after both individual employees, but also how you as a manager can support your team or as a colleague can support your team as well. And then we'll just finish off by giving you some takeaways and some resources that you can take back into your workplace before we open up that Q&A. So let's begin. We'll have a look at that role of health assessments and cancer screening to start us off. Just by kind of introducing a little bit more high level about health assessments as a whole before we kind of just drill down a little bit further into cancer screening. Specifically, health assessments are a test or a group of tests that are performed on asymptomatic individuals, so people who don't have any obvious signs or symptoms of an illness or a disease. And we do this to help us to assess the likelihood of them having or developing a particular disease. Now, in the case of corporate wellbeing, it's a set of tests completed on employees at their workplace to help them keep better track of their health and wellbeing and then reduce that risk of lifestyle diseases. So things like diabetes, cardiovascular disease, and of course, today's session, cancer. Now, health assessments, they can include measures on things like blood pressure, blood cholesterol, blood glucose, body mass index, and also waist circumference. But depending on the packages chosen, they might also include things like fitness testing, mental wellbeing support, further comprehensive blood testings, and specific cancer tests, which, like I said, we'll drill down to in the next few slides. And due to this being carried out on symptomless individuals, it can enable much early detection of results that might otherwise be missed if we wait. Now, once some screening has taken place, we can then pair those results with a proactive way of looking at our lifestyle. So looking at the things that we're eating, we're drinking, our sleep, stress, or even things like alcohol consumption. And when we look at our health, we can split this into modifiable and non-modifiable risk factors. So unfortunately, we can't do anything about our age, our biological sex, our family history or ethnicity, but we can change our lifestyle, such as how much exercise we do, what we eat, whether we smoke and whether we drink alcohol. So a health assessment or a health screening enables us to explore what we currently do, what we should be doing, and then actually set ourselves some personal goals that we can work towards. And they're really important because it enables us to have that early detection of disease. So, particularly, they can detect potential health problems at an early stage when they're much more treatable. So, for things like cancer in this instance, it can actually improve outcomes and reduce the risk of complications. Cost is always a really big factor, particularly detecting disease early through some sort of screening. It can help to reduce healthcare costs in the long run because treating disease in their early stages is often less expensive than treating advanced stages of illness or managing complications. And then the final point around why they're important is this improved quality of life, particularly that early detection and treatment of disease, and any disease, with that can prevent or delay the onset of symptoms and complications, thereby improving quality of life, not only for the individuals, but also their families. And just before we move on to really drill down to that cancer screening in particular, I think while we're looking at what a health assessment is, it's really important as well to actually look at what a health assessment isn't. It's not a safety critical medical. It's not something that you need to do to be deemed fit to work, and nor does it fall into any other band or part of occupational health. When having a health assessment, your individual results are never reported back to your line manager or company. It's for you, this is your assessment, it's what you want to get out of it. And sometimes I feel like this misunderstanding can put up barriers for employees to take up an assessment, so they miss out on the opportunity to take a more proactive approach to their health and well-being. So of an understanding of kind of what that overarching band of health assessments or health screening is, let's just drill down a little bit further to have a look at that specifically, cancer screening. So cancer screening is a medical process aimed at detecting cancer before any symptoms appear. Really, its primary purpose is to identify cancer at an early stage when treatment is much more likely to be effective. And cancer screening tests are usually recommended for individuals who are at a higher risk of developing certain types of cancer, which may be down to some of those non modifiable risk factors that I've just mentioned, such as age or family history, or actually down to those modifiable risk factors, such as their lifestyle choices. And what I've done here on the screen is just really put down really sort of four of the most common cancer screening tests that you're likely to kind of see or come across, or as you age, actually get offered. So particularly mammography is a screening tool for breast cancer, which uses a low dose X-ray to detect any abnormalities in breast tissue. Particularly, regular mammograms are recommended for women over a certain age, and they typically will start around the age of 50 years of age. Typically, with the NHS at the moment, you'll be invited between 50 and 53 years of age. We then have fecal occult blood testing, which is a bit of a mouthful for Friday morning, but it's often referred to as either a FOB test or a FIT test. Now, these tests screen for any colorectal cancer by examining the colon for polyps, so little growths, or any abnormal growths that we see. And particularly the FOB test will detect hidden blood, which you actually can't see with with the human eye, but it will detect any blood samples that we see within that stool sample. And you've also got within that kind of fecal blood testing, there is also colonoscopies as well, which will involve the insertion of a flexible tube with the camera into the colon. And you will typically see those two tests go hand in hand when we're looking at screening for colon or bowel cancer. The third most common, which is cervical screening or smear tests, as they're commonly referred to. This screening will look for cervical cancer, which involves collecting cells from the cervix to check for abnormalities. It's very common for females to be introduced to these in their early 20s and then go for routine screening, normally every 3 to 5 years, depending upon what their previous results have shown. And within this cervical screening, you will also be offered a HPV, so a human papillomavirus test, which may also be performed in conjunction with that smear, just to look for the presence of HPV, which may cause some changes within the cells. And then lastly, and actually one of the most common that we will provide as part of those health assessments packages, which I mentioned beforehand, are blood tests. So we've got two different types of blood tests here. The first is an ovarian cancer screening test, which is commonly referred to as a CA125. This is offered to females to screen for this particular enzyme or protein, which might increase the risk of ovarian cancer. And then for males, typically over the age of 50, will be offered a PSA test or a prostate specific antigen test. This will obviously look at the levels of PSA, so again, that enzyme, which is produced by the prostate gland, and it may indicate the presence of prostate cancer, although further testing is needed just to confirm that diagnosis, because it could also be benign or an enlarged prostate. Why is all this important? Why is looking at cancer screening and cancer detection important? Well, I mentioned when I was looking at health assessments or health screening right from the outset about this improved kind of treatment outcomes. Particularly, detecting cancer at an early stage generally leads to more effective treatment options and better outcomes. Um, Certainly, early stage cancers are often easy to treat and may require less aggressive therapies, resulting in higher cure rates, but also improved survival rates as well. And this also links to the impact of cost as well, which I'm going to talk about on the second slide when we just have a look at kind of the link with PMI or private medical insurance. It also reduces the risk of mortality. So, screening can help reduce cancer related deaths by detecting tumours before they even have a chance to spread to other parts of the body. By identifying cancer in its early stages, treatment can be initiated more promptly, increasing the likelihood of successful outcomes and reducing mortality rates. And particularly, the survival rate for cancer is strongly related to the stage of the disease at the time of diagnosis. So just to give you a couple of examples here, women whose breast cancer was detected through screening, so through that mammography, had a 25% lower risk of dying from the disease compared to those whose cancer diagnosis was actually detected at a later stage. And particularly when we're looking at stage 1 ovarian cancer, if you haven't already, we actually delivered an ovarian cancer webinar last March, so do go and check that out on our YouTube channel. But particularly, almost 95 out of 100 women will survive their cancer diagnosis for 5 years or more after they were diagnosed, if it's kind of captured in stage 1. And there are 4 stages when we're looking at ovarian cancer screening. So it is really important to, certainly if you're getting your NHS kind of invitations, do go and have those screening checks. But also for the workplace, it's something which is worth exploring if it's offered through your employer. I mentioned earlier as well that the benefits also include less invasive treatments. So what I mean by this is that early detection will also allow for less invasive treatment options, such as more localized surgeries or targeted therapies, which can minimize side effects and again improve that quality of life, like I mentioned from the outset. And we also come back to this piece around cost as well. Whilst, yes, cancer screening programs do involve that upfront cost, they're often really cost effective in the long term because they will reduce that need for expensive treatments and improve overall health outcomes. And if PMI is available, we do see a reduction in monetary claims from PMI, so private medical insurance, due to less aggressive treatment options needed. And that was something that was really interesting that we've seen with some of our clients in 2023. Their claims for cancer, whilst the claims over the last 3 years, so really since the pandemic, have actually now started to reduce, the financial burden is actually still number one when it comes to their PMI claims for cancer screening. And unfortunately, the reason for this is because people are actually being diagnosed at a much later stage within that kind of progression of their cancer and are needing those much more invasive and advanced treatment options, which is then kind of shooting up that PMI. So it really is important just to look at that early detection and that early screening. So I think really overall, when it comes to benefits, cancer screening is a valuable tool in the fight against cancer, offering the potential to detect and treat the disease at its earliest and most treatable stages, ultimately saving lives and improving quality of life for individuals diagnosed with cancer. But let's just actually pull this into the workplace. We've really just touched about it on a kind of a personal and individual level. So let's actually have a look at cancer screening in the workforce. Many companies will offer health and wellbeing perks to employees as part of their benefits packages or as part of health and wellbeing strategies, as well as actually giving access to streamlined diagnostic pathways, particularly for those with cancer symptoms. But it's interesting to actually look at, well, how many actually include cancer screening, that more proactive support? We've got the reactive piece around these diagnostic pathways, but what are we actually doing as a workforce to support people right from the outset? It's reported that 2.5 million people in the UK currently are living with cancer, and the associated cost to the UK economy is calculated at 7.6 billion in lost wages and benefits. And the impact of cancer diagnosis in the workplace is wide reaching, both on employers and employees. And we see that over half, so 53% of employees diagnosed with cancer face lower income and 76% a negative impact on their family life. So, with more than 3 million people missing their screening appointments in England during that COVID-19 pandemic, there's never been a better time to review cancer strategies for employees because we're still negotiating that backlog of treatment. So, particularly, an increased focus on cancer prevention should really use personal risk assessments and what we refer to as risk stratified screening. And that does require employees to take some personal responsibility for their own health and, obviously, in this case, their own cancer risk. However, if employers provide the necessary education to allow employees to understand their personal risk and provide access into screening for those at higher risks, then the way that screening is delivered to the workforce actually can be revolutionised with benefits for both employees and employers. So it's really focusing on that prevention rather than cure piece. So, just before I hand over to Adam to take you through how to support colleagues affected by cancer, I just wanted to give some three takeaways here. I've really talked a bit about that kind of personal level around cancer screening and what options are available. But if I was to give you three takeaways specifically for employers, particularly, like I've said, that cancer education and some risk reduction strategies. So, not just the reactive, but the proactive piece really should become a cornerstone for future health and wellbeing strategies. So, certainly something to have a look at. Employers should also provide access to programs that support behaviour change to lower individual risk. So, this is really referring to individual risk for overall health and well-being. So, whether it is cancer screening or even things like diabetes and cardiovascular disease risk. And implement risk stratified cancer screening. If you know that you have a workforce, for example, that are predominantly male over the age of 50, What are you doing to actually support them with, prostate cancer awareness, education, screening, support? So look at that demographic of your workforce and really start to unpick what are some of the key risks that these individuals are going to face, and what can you do as an employer sooner rather than later. We're going to just talk to you about some of the options that we do have for you at the end, but I'd now like to just hand you over to Adam, who will talk you through supporting colleagues affected by cancer.
Thank you very much, Laura. And I don't know about anybody else, but I really took a lot from listening to Laura's piece there, particularly being a male, about how important it is to have those tests as well. So I'd encourage all males, if you haven't had a prostate test and it's available, do it. We know that there's many famous people, even our monarchy has had tests. So, it's really important that we do get that and that we all look after our well-being there. So thank you very much, Laura, much appreciated there. So following on from Laura's presentation, we're now going to look at what you can do as managers, leaders and colleagues to support anybody who's been affected by a cancer diagnosis. And considering what we've covered so far, you'll be aware that every staff member support needs who's been diagnosed with cancer will be different. However, there are particular times where managerial input, for example, can have a significant benefit in supporting employees' mental well-being at the time. Now, we're going to outline these on the slide. And as you can see, communication and reappraisal of support are fundamental in this process. For example, communication can be a key factor in supporting a colleague affected by cancer. So use your judgment to ascertain the right level of communication. Some employees will appreciate regular check-ins and words of support. Others will prefer time and space without much input from work, and who may prefer to access their own support services, whether that be their own personal network of family, friends, etc. Now, communication and check-ins are vital in supporting an individual, and this is so that you can gauge whether the type and degree of support is relevant. And it may help inform your operational decisions, things like staffing requirements, etc. So here are a few key times and circumstances when your consideration as a manager may be required. Firstly, at the initial disclosure of diagnosis. It's important in any supportive conversations that you actively listen and be mindful of confidentiality. So also be aware of the type and level of support which could be discussed and agreed between yourself, such as, if the person is taking some time off work, what type, how many welfare calls would they require, and what sort of communication method is best for them. Would they prefer a telephone call? Do they prefer text or even a home visit or coming into work to talk about what is going on for them? And if appropriate, you could offer information related to internal and external support services. So, for example, PAM Assist, any counselling that's available, leaflets, and so on and so forth. Next, work status. This refers to those who choose to take sick leave or other forms of leave following their diagnosis. So again, provide the type and level of support agreed with the employee. Be aware of your organisation's policies regarding leave, and be aware that some people may require more time and others may want to return sooner. And when it comes to return to work, make sure there is comprehensive but flexible return to work planning in place. And this is essential to support an individual during this time, as for some, this could be a daunting process. Now, in the return to work, the type of, if you like, adjustments that you could make could include things like decreased caseloads, access to additional breaks, and you also might want to consider, for example, the type of caseloads that somebody might be working with. So, for example, if you work with bereavement cases or cancer cases themselves, then that might be emotionally triggering for that person. So again, it's about looking at that and thinking what might be best for that person. But it's a discussion to have with them. Also, maybe look at things like a phased return, changes shifts if needed, particularly if treatment's being had and that person is likely to be struggling physically and psychologically because of treatment. Maybe temporary move to different departments, again, something to talk about with the employee, and any additional colleague or management support that may be required. Now, many people may want to get back to normal following treatment, but it's also important that they're encouraged to take time to ensure that they're well enough before planning a return to work, as presenteeism may be an issue, particularly if there are some external factors that may be putting pressure on them coming back to work, such as financial pressures. And they may be, therefore, at higher risk of presenteeism. So make sure all channels of communication are open. Make sure that you have regular check-ins throughout the return to work process, and also make sure that you provide all support that's available. And in the first 12 months after diagnosis, as we covered earlier, the emotional impact does not have a timeline, and it's going to be individual. So difficulties may arise at any time, not just in the first 12 months. Sometimes life circumstances years later can resurface emotions related to the illness at any time. So, for example, if somebody was planning to start a family, or the impact of additional losses or other diagnoses. And again, treatment may also have to be restarted later down the line. Therefore, it's important to be mindful of this and again, providing relevant support. Now, when it comes to communicating with a colleague who has been diagnosed with cancer, it's important to recognise there's no single way to have those discussions. But it can also be helpful as a manager and a leader and a colleague to have a few broad do's and don'ts that could be helpful. And the first is to make sure that you listen. Okay, don't be afraid of silences. Let your employee take the lead in communication and go at their pace. Now, it's also vitally important, given that they might have been receiving treatment and therefore might not be able to obtain lots of information, that you don't give them lots of information all at once. But it's still vital to give that, but maybe drip feed it, okay? And do it when the time seems right. You could also ask them about how they're feeling emotionally and physically. Also, what information they want to be shared about their diagnosis, and also with whom. You might also want to ask them what sort of time off they might need for medical appointments and treatment if that's known. You could also offer information about the options for time off. Remember your organisation's policies on flexible working, work adjustments, and return to work after sick leave. And also remember their rights under the Equality Act 2010, which covers people with a cancer diagnosis and carers legislation. And again, remember that all the signposting to services that your organisations offers. So this could be internally and externally, again, for example, PAM Assist. Now, you might want to close the meeting with the employee with an assurance that their work is valued and that the door is always open for them to come and talk to you. And also agree a date and time to meet them again to review things and how they're working or maybe not working, so that, again, adjustments can be made in a timely manner. Other ways to look at how to psychologically support somebody with a diagnosis of cancer could be to respect the employee's dignity and privacy. Again, if they don't want others to know, that is their choice. So, do they want someone else to make staff aware rather than you? Also, make sure the employee stays involved and is engaged. So make sure that you talk to them, that you stay in touch in a way that's going to be beneficial to them. And it's vitally important, particularly in the cost of living crisis that we're all facing, that you ensure they suffer no financial determinant. So make sure to the best of your ability that the organisation ensures that the individual is compensated, make sure that they have the right salary and benefits, and that also make sure that it's laid down by HR policy what they're entitled to. And also make sure employees are aware of any relevant schemes provided by the company that they could be entitled to while they're off sick or returning to work. Also, make sure that you provide the employee with advice around what support is available. For example, the Citizens Advice Bureau can advise on a range of financial issues and will help people negotiate the benefits system. You can find a local branch by contacting the Citizens Advice online. Their website has a useful fact sheet as well. The Pensions Advisory Service is also an independent non-profit organisation that provides free information, advice and guidance on the whole spectrum of pensions. So again, it can be really helpful if somebody has had a diagnosis to know where they stand with their pension, who it can go to, etc. DirectGov is the official government website for public services and information. Now, the best starting point for basic information on finances is the government's online information portal, www.direct.gov.uk. This is a one-stop shop with information on things like benefits, pensions, other financial matters, and employment rights. And also, there's the DWP Access to Work programme. This is a job centre held budget that can help buy support to help the disabled or those with serious health conditions at work. And it can be accessed by those who are in as well as out of work, and costs are refunded to the employer or employee. And additionally, Macmillan Resources can help with money matters. When people contact Macmillan, money is one of the most common worries that they hear about, but they're well equipped to help, offering a wide range of publications and services. Macmillan publications on financial matters can be ordered free of charge from their b.macmillan.org.uk website, and they have a few booklets which can offer help and support, things like their All Adds Up series published with the help of the Financial Service Authority, financial planning, pensions, insurance, and so on and so forth. And also make sure as an employee you continue to provide employee benefits. The organisation should work with the employee to ease the stress of any issues in relation to insured benefits offered by the organisation, such as we've called things like private healthcare or permanent healthcare insurance, and again, the long-term disability insurance schemes. And make sure you adapt a flexible approach. The employee should know who to contact if their situation suddenly changes. They should also know that cancer is a disability under the DDA. So if the employee plans to work through some or all of their treatment, or while they're offering support to a family member or care dependent, they should be helped to do so by their employer by making reasonable adjustments to their working hours, again, their workplace, workload, etc. An employee that has a family member that is also diagnosed with cancer, that may be terminal, may need extra time off work to spend with their relative. Now, this may require additional flexibility and compassionate leave, and it can be helpful to discuss with the employee how they would like you to communicate with them during this time. And make sure, again, you offer support to them and the wider team. Make sure an occupational health referral with the consent of the individual is made. If an employee suffers temporary or permanent disability as a result of their cancer or cancer treatment, and this affects their return to work, the employer should work with them to make reasonable adjustments to continue in work. Again, they may be eligible for help from Access to Work, that scheme which is run by the Department for Work and Pensions. Access to Work carries out an assessment of the needs of the disabled person at work and produces a report for the employer that recommends any changes that the employer needs to make. Access to Work also reimburses employers of disabled people with up to 80% of the cost of any special help that the employee needs because of their disability. And again, as an employer, make sure that you continue to provide access to appropriate professional development opportunities subject to their availability to attend. Again, don't discriminate because of their illness. And provide the employee with information and support. The organisation should make every effort to link the employee with available resources will then enable them to access cancer information and support, among other things, treatment absence from work, as well as successful reintegration into work. That you should also direct employees to sources of financial and, if needed, legal advice. Again, provide them with resources and information available to family members of friends as well as work colleagues where appropriate. And also ensure that cancer information and support is provided to employees from minority ethnic communities and is also culturally appropriate. And it may be of help to direct employees to additional services such as cancer backup or to internal support groups if they exist, such as PAM Assist. And make sure that you support the whole team affected by the employee's situation. Managers should remain sensitive to the impact on co-workers and provide practical support where necessary, which we're going to look at just now. Now, sometimes it can help teams to channel their energies into fundraising, etc. But make sure that this is discussed sensitively with the person experiencing cancer first to check that they are comfortable with this. Discuss ideas within the team on how workload can be managed in such a way that their colleague still feels able to contribute without too much pressure. For example, urgent deadline-driven activities could be reallocated, but again, discuss this with your employee first before making any changes to see if they have any ideas. And if you do involve them to be in any cover arrangements you put in place, it's likely to be easy for them to accept the fact that someone else is doing their job for the time being, particularly if it's something that they've had a responsibility or an ownership for a prolonged period of time. Okay. Hopefully that's helped you all with some of the things that can help support your colleagues psychologically in these very difficult times. And I'm going to hand back now to Laura to discuss some of the key takeaways that we hope you take away from this broadcast session. And also, we're going to be available at the end for your questions. Thank you, Laura.
Awesome, thank you, Adam. Nice to have a mashup of the physiological side and the psychological side and how to support as well. So thank you for that. I hope I can do us justice within, this 40-minute session now with some key takeaways, so kind of some key points for you to take away from all of the information that we've gone through with you today. I think first and foremost, just to remind us what we went through in the first part of the session is that early screening. So we're really focusing on that prevention rather than cure. Particularly, it allows earlier treatment access, hopefully less invasive treatment, a reduction in both the treatment but also all-cause mortality. And in turn, it can reduce costs not only for the individual, but also the workplace and within PMI claims if they're appropriate as well. Particularly, we're seeing more and more now that employees are actually focusing on more of a risk stratified screening and program and strategies when it comes to the workplace. And I think it's worth just extending that not just to cancer, but other illnesses and disease and really risks that your workforce will experience or will be impacted by from a health and wellbeing perspective, whether that is physical health or mental health as well. So it's certainly worth looking at what you're doing internally when it comes to your data sources to actually look at doing that risk stratification exercise. And I think one of the most important things that I took away from Adam's section was communicate, communicate, communicate. It is the most powerful tool that you will have. And certainly having that regular conversation and those open conversations to really understand, what's right for the employee. Everybody's going to be very different. So what's right for the employee, what's right for their co-workers. But know what tools you've got available to you. Often as a workforce, you actually probably have more at your disposal than you think. So whether it is, as Adam said, occupational health referrals, whether it is utilising an employee assistance programme, often as a manager in particular, you'll have those tools. So it's really about understanding, how does your workforce access them? But how do you actually get the most out of them? So, for example, really truly understanding how do you make a great management referral into occupational health, for example. So Adam and I obviously finish up and take any questions you might have. I just wanted to leave you with some of the services that we offer. So as I mentioned right from the outset of today's session, this is our first, it's our inaugural PAM Wellness free session for 2024. So you have got plenty of training and workshops available to your workforce. And I'll leave you shortly with our information if you do want to look at any of those topics available. But as you can see on your screen there, you've really just got a handful of what we offer, anything from, supporting colleagues affected by cancer if you're looking for our more in-depth version of this session, things like women's health, men's health, smoking cessation, grief and loss, as well as over 80 more topics around corporate health, mental health, and also well-being for you to tap into as well. So before we open up to any questions, obviously, if you are interested in finding more about any of those training and workshops that I've just taken you through on the previous slide, or you're interested in learning a little bit more about health screening, whether that is our kind of full body assessments or whether it's a little bit more specific to cancer screening, then you've got our details there for you on the screen. Business support at pamwellbeing.co.uk, or you can get in contact with the team on 01925 976 111. And with that, we'll open up the lines. If you have got any questions, you'll see at the top of your team that you will have your Q&A available. You've also got the chat box. So has anybody got any questions for Adam and I at all? I'm just going to have a quick look in the chat box. I can see there's been a flurry of chat as we've been chatting, Adam. So I'll have a little look and just see what comes through. I've actually got one here from Phil Baker, so I'm going to work myself up if that's okay. So there's a question from Phil. It comes across that GPs determined from having PSA tests for prostate cancer unless there are specific symptoms as the test isn't perfect. Any views? Oh, great question. I actually really like this question as well. So the reason some GPs may deter from PSA testing will really be dependent upon age more than anything. So particularly you do have the risk of what we call false negatives and false positives. So certainly if you are a young male, for example, more so under the age of 45 and you're going for a PSA test, you do run the risk of having false negatives and false positives. And obviously with that, you may have to undergo further treatment that's actually unnecessary. So it's really recommended that if you are experiencing kind of any signs or symptoms, for example, you might be getting up during the night to urinate more. You may find that you can't hold your bladder as well. You're getting some trickling sensations. They are just to name but a few. Then, of course, go and have those conversations with your GP. But particularly cancer screening, depending upon what region you are within the UK, it's normally offered over the age of 50 for males who are white British and over the age of 45 for Black and African males. And that's because of the risk factors associated. So if you are under that age bracket, you may find that GPs are less forthcoming, is probably the best word, to actually do a PSA test for you. And that will be fairly similar with bowel screening as well. So I hope that answers your question, Philip. Certainly I would say, if you are over the age of 45 or 50, it's certainly something to pursue with your GP because you will be entitled within like kind of national health screening programs for prostate to have those tests done. But that may be why you're coming across a few barriers, is because there is false positives and false negatives. So that's, I think, what you're alluding to when you say the test isn't perfect.
On that subject, does it also depend maybe on the local health authority? I mean, locally to where I live, they had a prostate cancer screening pop up, if you like, in one of the civic halls, and they just invited men from the local area to come and get their bloods done, and the tests were given that day. And so me and my dad went. We encouraged loads of other people to go, and it was a really good success, in terms of screening. I think they found people that had, unfortunately, tested, but it was good that they had got in there to get it tested so they could get the right treatment path. So yeah,
it's really well worth doing. I think it's just, if you are going to have a PSA test done, and you are under the age of 45, if you're Black African, or 50 for, white British, then you need to be mindful that there could well be false negatives and false positives. But at the same time, if you've got a very strong family history of prostate cancer, then I would encourage you to have those conversations maybe sooner with your GP, so that when it comes round to having that regular cancer screening, that you have got it available as well. I think for yourself, Adam, from K-Sut in the chat. So would you advise if it's also good to share with colleagues one's own knowledge of complementary therapies to access alongside hospital treatments?
I guess, again, maybe complementary therapies, we're talking maybe more physiological complementary therapies. I guess if it's something that's worked for you, then why not? But I'd always recommend, if anybody's receiving any treatment from a hospital or GP, that they always ask before taking any other supplements, complementary therapies, etc., just to make sure it's going to have no impact on their current treatment, and just to see if that's okay. That's in my opinion. What about you, Laura?
Yeah, no, I think I'm just going to reread the question again. So would you advise if it's also good to share with colleagues one's own knowledge of complementary therapies to access? I don't think there's any harm in it at all. I think it's one of those where, sometimes sharing information can be really helpful, but it's just being mindful of what works for one person may not work for another. So it's just about going about it in a sensitive way. And I think it comes back to, Adam, what you were saying around that, that communication piece, and just being mindful. Some people might not want to know about other any other treatments that are available. So I think it's just being mindful and aware of what's right for the individual.
Yeah.
Might have a question for me actually from Julie. So why would purchase of screening from yourselves be a good idea if already supplied by the NHS to those over the critical ages, given what you said about false positives? So why would purchase of screening from yourselves be a good idea by the NHS for those? I think if you're already getting screening through the NHS because you're over a certain age, for whether it's mammograms, bowel screening, or prostate screening in particular, they're the 3 national programmes, then absolutely continue with that. If you're having screening and you are having it done at the point of the screening age, then there are lower risks of those false negatives and false positives. So I hope that's answered your question there, Julie. One thing that's interesting to note is there isn't actually a national screening programme for ovarian cancer, and this is through that CA125 blood test that I mentioned earlier. The reason for that is because there is still a multitude of research about kind of the risks and the treatments that are available. But what's really interesting is that there was a study done in 2022, if my memory serves, between King's College and one other, and it actually looked at buying history of females. And because the symptoms of ovarian cancer in particular are quite vague, a lot of the symptoms can be misconstrued with like IBS, for example. And they actually found that a lot of women who were purchasing things like paracetamol and ibuprofen and kind of IBS medication, I can't think of the brand off the top of my head, actually did find they had ovarian cancer 6 to 8 months later. But there aren't national screening programs for ovarian cancer just because it's still going through I guess that risk profiling for those false negatives and false positives. But I think just going back to your question, G, just so I can make sure I've answered it appropriately, if you're already at that screening age and you're accessing, whether it's bowel or mammography or, PSA testing for males through the NHS, then absolutely well worth doing. Screening programs that are offered through ourselves, there are plenty of, private blood testing companies out there where you can have it done. It's just making sure that you as an individual know that there are risks with anything involved when you're doing screening, but providing you're of the appropriate age, you will find that those false negatives and false positives will be a lot less than if you were doing a test in your 20s or 30s, for example. I see there's a question from Catherine Ty. Prostate cancer screening is not part of the NHS cancer screening programme. although can discuss with GP. You should really be offered, depending on what regions you're in, you should be offered prostate cancer screening test as soon as you're over the age of 50. Usually it's done normally every 5 years. If you haven't been offered it, it's certainly worth doing it, having that conversation with your GP. And there's a question around what is the age targeted for ovarian cancer screening. Again, usually the age of 45. You tend to find this 45, 50 is kind of like your kind of key age bracket when it comes to health screening. Again, there's nothing stopping people if they want to have it done when they're younger. It's just about being mindful that if they are getting false positives, it may lead to kind of invasive treatment that they don't really need. I'm just going to read Julie's response. I agree. We have an old lady who has been treated remotely for urinary infections for months, only to now have been told she actually had a huge tumour on her bowel. No, sorry to hear that. It's, I mean, some of the research and it's quite interesting actually. I mean, it shows kind of people's buying history and their not buying history. What's what I'm looking for? Habits. Their buying habits. Particularly people who. And it's actually more so women tended to kind of self-treat and self-medicate and actually realised they had something a little bit more kind of untoward further down the line. But I think I would just finish by saying, any signs and symptoms that you have that are not normal for you, do go and get them checked out by your GP sooner rather than later. It's better just to be, safe than sorry. And if anything, you will find the list of signs and symptoms, particularly on the NHS website. They are very good for that, but definitely something to look into. Thank you for your questions. It's kept me on my toes this morning. I'm just going to have a quick look through the chat just to make sure we haven't missed anything. Obviously, if you do have any other kind of questions or comments, please pop them through. I think we've hit the rest of the questions now, which is great. So we'll close off the meeting unless anybody has any questions at all. But I think just from myself, a massive thank you for joining us this morning. And like I said, if you do have any questions, please feel free just to either pop them in the chat box or you can get in contact with us. If you think of a question afterwards, then do send us it through to businesssupport@pamwellbeing.co.uk. And of course, if you've got any further information you'd like about the sessions, you can let us know.
Brilliant. Thanks very much, Laura. And thank you again, everybody, for your attendance. Again, just echoing what Laura said there as well, if you've got anything that you'd like to ask about any other sessions that we run as well, or anything that we've covered, feel free to ask either in the chat or again, contact that email address and we'll be delighted to help.
Awesome. Thanks, everybody. Have a great Friday.
Thanks, everyone. Take care now. Bye-bye.
Take care. Bye-bye.